Hello, it's Maria Crown. So for Unit 9, I'd like to talk about a patient with bipolar disorder and a recent weight loss surgery. So when we got him, he was already on ziprasidone or geodone for an inpatient, prescribed by an inpatient provider for mania. He was also already on lamotrigine, and the plan was to slowly transition him off of ziprasidone and then to Vraylar for long-term mood stabilization. At the time of the follow-up, he had already been in Vraylar for about a month, but he was still having some pretty bad and persistent auditory hallucinations. After further assessment, it became clear that because of his post-surgery diet, he wasn't eating enough to meet the calorie requirement needed for ziprasidone to work properly. So he was most likely not absorbing much of it all. So looking back, a limitation on my end was not thinking early enough about calorie requirements for certain medications, especially for someone with bariatric surgeries or perhaps for patients with celiac disease and just digestive absorption issues. I haven't looked in depth on those issues, right? It was also a reminder of how easy it is to assume symptoms or a medication isn't working, when in reality we have to look further or beyond just that. We have to look into factors such as, is the patient taking it? Is the patient taking it on time? Is the patient taking it with food or not? So learning lesson in this is to just be very intentional about looking at the person as a whole, and understanding their routines, not just the diagnosis, not just the medication, but to understand and assess all the factors that could be potentially impacting or affecting the medications. That's all. Thank you.